Good morning, good afternoon, and good evening to all. Welcome to the official side event of the EcoSoc Youth Forum, promoting adolescent well-being to secure our future. My name is Mirat Khalil. I'm the founder of Your Egyptian Doula, and it is my pleasure to moderate this very exciting session, led by and for young people. The current generation of young people is the largest ever in the history of humankind. There are currently 1.8 billion people between the ages of 10 and 24, constituting nearly 24% of the world's population. Yet, the global community has paid insufficient attention to the multidimensional and intersectional nature of adolescents' well-being and the importance of the transition to young adulthood. People have too often wrongly assumed that as long as a young person is given formal education and access to basic healthcare, their well-being will take care of itself. You would be surprised to know that nearly 4,000 adolescents and young adults die each day from largely preventable conditions. Efforts to promote young people's well-being have tended to be piecemeal, with different sectors focusing exclusively on their own areas of expertise and sometimes losing sight of the overall objective of promoting adolescents' rights and well-being. COVID-19 has been a stark reminder of the inequalities that the world continues to grapple with. In the wake of COVID-19, many adolescents have experienced disruptions to their access to health, education, and preventative service before and after the pandemic. The pandemic has further exacerbated these inequalities. It's critical that global, regional, national, and community-level policies and programs address young people's needs holistically and comprehensively. WHO and PMNCH, in collaboration with UNH6+ partners, hosted 8 regional multi-stakeholder consultations between June and August of 2021. These were used to identify gaps in knowledge for this specific population group. The findings from this consultation have been synthesized in a report, which we are proud to launch today. During this event, we will discuss some of the gaps identified during this consultation and the recommendations made to address these gaps and to mainstream and integrate adolescent well-being into national and subnational development plans. As we dive into this discussion today, it is critical to remember that adolescent, youth, and youth-led organizations are at the heart of this initiative. Young people, the SDG generation, should be leading and co-owning this movement, demanding sustained investment and political prioritization, creating an enabling environment to thrive and achieve their full potential. Before we move ahead, I would like to remind you of 3 key recommendations in the call to action for adolescents. Number 1, engage and empower adolescents. Number 2, go beyond the health sector and launch a multi-sectoral response. And number 3, garner support for adolescents and youth through the Global Forum on Adolescence in 2023. Additionally, I would also like to share the global social media campaign, #Adolescence2030, which is a youth-led movement raising the importance of a holistic approach to adolescent well-being. We are very grateful to the UN agencies, including WHO and PMNCH, who are supporting us on this effort to mobilize endorsements of the call for action for adolescents. You can check out the website, www.adolescence2030.org, for more information. And remember to use the hashtag #Adolescence2030 in your posts to show solidarity with young people today, as well as #EcoSoc to amplify the messages in the EcoSoc Youth Forum. As we start our event today, I would like to invite Dr. Anshu Banerjee, Director of WHO's Department of Maternal, Newborn and Child Health, who will give the opening remarks and a keynote address focusing on adolescent well-being, highlighting this as a priority and offering the key findings and actions from the report. Dr. Anshu, the floor is yours.
Thank you very much, Miret. And it's a pleasure to participate today at this EcoSoc Youth Forum side event and say something about the UNH6+ Adolescent Wellbeing Initiative. As Miret already mentioned, we launched the call to action for adolescents in 2019, and she just highlighted the 3 recommendations. The first one, engage and empower adolescents. Secondly, to go beyond the health sector and launching a powerful multisectoral response. And thirdly, to strengthen the political commitments and funding through a global forum for adolescents in 2023. As you can see, the conceptual framework, which was published in 2020, outlines a definition for adolescent well-being. This is where adolescents thrive and are able to achieve their full potential. There are also 5 interlinking domains and 27 subdomains. The 5 major domains include, first of all, good health and optimum nutrition. Secondly, connectedness, positive values, and contributions to society. Further, we have safety and a supportive environment. Fourthly, learning, competence, education, skills, and employability. And as the last one, agency and resilience. WHO, PMNCH, the UNH6+, and partners have been building momentum through consensus building, through partner engagement and political support, starting from, first of all, in 2019, the call to action for adolescents. This was followed by 9 global and regional youth consultations in 2020. Then we had a statement that was published endorsing the call to action in the BMJ by the heads of the UN agencies, heads of state, youth networks, professional associations in 2021. And finally, this work will culminate towards the UN Sustainable Development Goals Summit, the Global Forum for Adolescents, and the G20 meeting between September and November 2021. The multi-stakeholder consultations, organized in 6 regions in 2021, aimed to reach broad agreement on policies and programming to promote adolescent well-being. It addressed the following questions. Why should national and local governments, NGOs, and others invest in adolescent well-being? What evidence-based policies and programs are needed to promote adolescent well-being globally and in different contexts? What are the most important gaps in what countries and other stakeholders will want to know to make commitments at the Global Forum for Adolescents in 2023? And finally, how to update the Global Accelerated Action for Health and Adolescents, also known as the AHA. In order to inform the consultations, together with over 80 partners, we developed 15 background papers, which addressed the 5 domains among other areas, such as also digital technologies and humanitarian and fragile settings. The papers will be published as a collection in the BMJ for launch at the UN General Assembly in September 22. The consultations were coordinated and hosted by the respective WHO regional offices with support from PMNCH, WHO headquarters, UNFPA, UNESCO, and UNICEF. Each consultation was held over 2 days, varying in length from between 2 to 4 hours a day. The consultations were attended by over 1,000 invited representatives of national and local governments, of youth networks, UN agencies, NGOs, healthcare professional associations, academics, donors, and foundations. This was really multi-stakeholder consultation. Regional offices are going to publish individual regional reports which are featured which are going to be featured in annexes of the global summary report. Now, why should governments invest in adolescent well-being? We have outlined 6 key reasons. First, the socio-economic case. Secondly, looking at human rights and gender equality. It's also important to look at health, nutrition, and well-being, at the education and well-being of adolescents, but also looking at connectedness and positive relationships, and finally, political stability and security. So what came out of these multi-stakeholder meetings? The consultations revealed some key gaps in knowledge and some persistent challenges and barriers affecting policy, strategy, and program implementation. The findings clearly indicate that adolescents' well-being is not receiving the attention it deserves, and that more needs to be done to convince decision makers of the need for coordinated investments in all 5 domains of the adolescent well-being framework. The report synthesizes key findings on specific areas of programming to promote adolescent well-being and highlights the following areas. There's a need for much stronger coordination. There's a need for more meaningful engagement of adolescents and young people. There's the need to generate information and evidence to build the case for investments in adolescent well-being. There's also a need to monitor the effectiveness and impact of adolescent programming to hold policymakers accountable. We need to avoid a siloed approach. We need to strengthen capacities to improve adolescent programming, including adolescent-friendly services. And finally, we need to harness the digital technology to address the growing digital divide, which is leaving the least connected adolescents behind. So what are the recommendations that emerged from these consultations? The report defines key asks for partners at national and subnational levels, including for governments. And in this forum, we want to hear from you and how you take these actions forward. So the first one is to advocate for adolescent well-being using a whole of government and whole of society approach. We need to investigate the status of adolescent well-being and ensure that there is an up-to-date landscape analysis. We need to review existing policies and strengthen national SDG strategies and encourage partners to endorse the global consensus statement on meaningful adolescent and youth engagement, or MAIE. We need to invest in digital technology, make it accessible to all, and improve information and training to promote well-being. There are also recommendations for the global level. So the following global level actions will be essential to ensure that the call to action is realized. PMNCH, WHO, the UNH6+, and partners will take on this work. We will advocate with member states to endorse the call to action for adolescents, utilize key decision-making moments to build momentum for the call to action, publish articles on policies and programming for adolescent well-being, and document and disseminate evidence-based examples and case studies. Further, we will implement the hashtag Adolescent 2030 campaign to mobilize high-level commitments, mobilize champions, including youth champions, with strong public influence to raise the visibility of the agenda. We'll develop an agreed comprehensive set of indicators for monitoring adolescent well-being, further develop the case for investing in adolescents' well-being, and finally, we will strengthen the capacity of partners, including by developing digital tools. So thank you very much for giving me an opportunity to highlight and summarize a little bit what the well-being framework is and what we hope to achieve with the call to action. Thank you, and back to you, Miret.
Thank you very much, Dr. Anshu, for that very comprehensive presentation. We will now move to the panel discussion. Today, we have an inspiring lineup of speakers who will share their thoughts and opinions on the need for mainstreaming adolescent well-being programming in development plans across countries. Today, I'm pleased to welcome, firstly, Shukti Anantha, an adolescent leader from the YP Foundation in India. Dr. Zoya Ali Rizvi, Deputy Commissioner of the National Health Mission, Ministry of Health and Family Welfare of the Government of India. Dr. Mona Brahim, Policy Engagement Coordinator of the UKRI GCRF Accelerating Achievement for Africa's Adolescent Hub at the University of Oxford. Joanna Herat, Senior Program Specialist and Team Leader for Sexuality, Education, SRH, and Gender at UNESCO. And last but not least, Elo Otobo, Senior Health Advocacy Advisor for RMNCHAH and Global Health Partnerships at Save the Children. It's a pleasure to have all of you here. Shukti, let me start with you. The multi-stakeholder consultations that took place last year focused on programming for adolescent well-being. While going through the report, were there any recommendations or discussions which resonated most with you?
Thank you for the question and this opportunity. I am from India, a country with the largest adolescent population in the world, all belonging to different communities, backgrounds, and social settings. In such a scenario, investing holistically in young people and creating an enabling environment for them to reach their full potential is a moral and social imperative. COVID-19 has affected adolescents drastically. School closures reduced face to face interaction with peers, increased the digital divide, deprived adolescents of some key skills and the opportunity to learn in a school setting. Basic health services were disrupted due to lockdowns, and many have lost their family members in the span of 2 years. In addition to having an impact on our physical health, the pandemic has led to an increase in mental issues faced by adolescents and youth across the country. Adolescents and youth across the world have faced a plethora of challenges, and it's critical that progress that has been made on adolescent health and well being in the past few years is not lost. As I read the report, I thought about my conversations with my peers and how the recommendations outlined in the report spoke to the challenges they had highlighted. While we have come a long way, we need to continue to engage adolescents and youth, consider them as equals and key stakeholders whose opinions in the curation and development of adolescent well-being programs is crucial. Adolescents from all communities, irrespective of their social groups or backgrounds, should be able to actively engage in the decision making, implementation, and monitoring of programs. As mentioned in the report, adolescent participation is very often tokenized, making it harder for them to be actively involved in decision making. More effort must be made to ensure that adolescents are engaged and empowered and don't just have a seat at the table, but also a voice at the table. Another recommendation that resonated with me was about the digital divide in adolescent participation. In India, almost 68% of the population consists of people from rural settings, prohibiting most of them from accessing internet services due to lack of good signal or the high prices or data packs. Although engaging digitally with adolescents is a great idea, it is important to note that it can have many gaps, especially for those that are underprivileged. As mentioned in the report, digital literacy is very important so as to teach young people about the advantages and disadvantages of the internet and the online world. It is important to reach out to vulnerable and marginalized groups through other platforms to ensure that they are included in the conversation and that there is equity when it comes to voicing out the concerns and difficulties of adolescents. We need stronger policies and programs to ensure that adolescents are aware of how to use digital media and platforms to improve engagement and access to information and services. We have come a long way, but there is still a lot to be done. Thank you.
Thank you very much, Shukti. Those were really inspiring reflections. Following up on what you've said, I'd like to ask Dr. Zoya, from a government perspective, in light of the recommendations mentioned in the report, what are some of the key actions that governments can prioritize at the national level?
Thank you, Miret, for the question. India has an adolescent population, like Shukti already mentioned, 253 million adolescents, the largest in the world. And not just in India, adolescents face a multitude of challenges across all boards. So, but I would just like to note that in India, we have been cognizant about the multifaceted, the multisectoral nature of the adolescent health and well-being even before COVID-19. Just to let you know that way back in 2014, to ensure the holistic development of adolescent, the Ministry of Health has already launched what we call the National Adolescent Health Program, which is the Rashtriya Kishore Swasthya Karyakram, a bit of mouthful. And this program, in fact, expanded from the initial scope of adolescent health, which was present in India, from being just limited to sexual reproductive health. Now it has covered the nutrition, injuries and violence, non-communicable diseases, mental health and substance abuse on one side. And initially from being just clinic-based, it now covers the adolescents where they are actually present, whether it is in schools, in communities, or at homes. After going through the report, I would say that every recommendation in this report is really critical for the government across the world, not just in India. But I would say the first step which we have to take is to acknowledge that the adolescent well-being is not just one dimension, it is a multi-dimensional nature concept. And we have to be sure to advocate for a holistic and a whole of government approach and not just health-based. And also this is the key pillar for adolescent well-being framework, as Anshu already mentioned, and the key ask of the call to action for adolescent, for which government of India has already endorsed. Besides this, there's also need to regularly map out the need of adolescents in the country to ensure that the policies and programs which we are adapting and making for this population is there, which will actually help in alleviating the unique challenges which are being faced by the adolescent in our country. So despite the unprecedented burden of the COVID-19, which brought forward, we in the government ensured that adolescents and the well-being was not neglected or sidelined, and that they actually had access to basic health services even during the lockdown. Lastly, before I end, I would say that it is critical to ensure that we engage adolescents and youth to better understand their needs. This actually includes establishing effective mechanisms and providing safe spaces like for adolescent leaders like Shukti right here, so that they're able to share what challenges they are facing and even, I would say, come up with the suggestions which are most welcome. For instance, let me just give an example. During the COVID lockdown, the express need for access to mental health services saw a huge raise. And we in the government actually managed to kind of tweak our program guidelines so that the support for the counselor, for the attending doctors, by training them virtually very quickly on mental health issues which were being faced by the adolescents and the youth, and also very easy ways how to support them, guide them to access services. Another example I can give is that you know that the key drivers for program being community-based intervention in our National Adolescent Health Program was outreach by the counselors and facility-based, both of which really suffered during COVID. But during the COVID lockdown, we plan to add teachers as one of the key service providers by giving them, I would say, capacity building, training them to hold interactive sessions with the school children on 11 themes, which included health, sanitation, media use, emotional well-being, just to name a few. So I would say in our constant endeavor to improve, the key findings of what Dr. Anshu has already mentioned is really important for us to keep in mind while we are developing and tweaking our adolescent strategies in the country. So before I would wrap up my inputs, I would just like to remind the audience that we have to remember that all the issues faced by adolescents are interconnected, and all of us have to work together to ensure that the adolescent and youth are able to achieve the highest standard of well-being for a better and healthier tomorrow. Thank you so much. Over to you, Miret.
Thank you, Dr. Zoya. Very, very moving and inspiring recommendations. I think you said it perfectly. The holistic approach is critical, and centering adolescent voices is the key to doing that. With that, I would like to ask Dr. Muna, as an academic, it would be good to hear from you as well. So building on the findings of the consultation, specifically as it relates to the evidence on adolescent well-being and the lack thereof, what do you think we as a community need to do to make the case for more investment in adolescent well-being?
Thank you, Marit. Let's start with what we do know. We know that there's been a sharp rise in violence and abuse. We know that 10 million more girls are at risk of child marriage. We know that the psychosocial stressors and economic stressors came hand in hand with youth unemployment. And we saw a skyrocketing rate of child and adolescent hunger over the past 2 years since COVID was announced. Now, these are only the consequential vulnerabilities. What we also know is that over 7 million young people under 18 have lost a primary or secondary caregiver to COVID-19. Now, from schools to parents, from health access to economic support, it's clear that the safety nets and infrastructure available for adolescents and young people is fragmenting. Now, despite these surging risks, young people are often overlooked, not only in COVID recovery plans, but also in universal health coverage and in access to public services in general. This has been emphasized through PMNCH's publications and through the consultations as well. As Dr. Zoya mentioned, there's also increasing evidence that these vulnerabilities are not independent of each other. We do need cost-effective interventions and packages that address multiple domains of adolescent well-being simultaneously. This will help youth not just survive, but thrive. Now, young people have spearheaded movements for climate change to stop inequality and to end discrimination. It's time for global leaders and actors to invest efforts and resources into their well-being for a change. Layered programming and policies for adolescent well-being is not a handout or a gift, it's a right. Thank you.
Let me again thank you, Mona, for reminding us of the importance of the rights-based approach, especially when we're talking about adolescents' well-being. Next, I would like to move to Joanna Herat. Joanna, given the impact that COVID-19 has had on the education of adolescents and young people across the world, particularly how COVID-19 closures and reopenings have really impacted education sectors, how has the sector provided protection and support to the community? And how do you think we can harness this multi-sectoral partnerships, including young people and policymakers?
Thank you, Meret. It's been so interesting hearing the ways that the previous speakers have put together these very similar ideas, and I think we're all so much on the same page with the recommendations from the report about this whole of society approach and a whole of government approach. But I will answer slightly from the perspective of education, because that's where we work and we intervene, and we want to make sure that education is doing what it can and is also able to engage with other sectors. The COVID-19 pandemic shut down schools all around the world. We all know that, we were all impacted by it, and it disrupted education for over 1.6 billion students at its peak. We now know that 24 million additional students may just drop out of the school system. So we need to be thinking about what do we do and where's the safety net for those learners. But some of the short-term consequences of these closures we already know about. So there's obviously very disrupted learners. I'm sure we all know of those students who, for example, are in exam years and they simply haven't had normal schooling for the last 2 years. It's incredibly stressful. It's a big toll on mental health, and it may well have an impact on their future opportunities. But there's also been disrupted access to nutrition. 370 million children in 150 countries missed out on school meals. There was a rise in dropout rates from schools, but there was also increased exposure to violence and exploitation. And then, as I mentioned, there was also this social isolation which young people experience, which was really have very, very full-on consequences on their mental health of adolescents. So these are just some of the consequences. So I think we can all agree that the impact on adolescents is undisputed. But some adolescents have been more impacted than others. And the situation has affected the most vulnerable learners the hardest. It's increased inequalities, and it's really exacerbated what was already a pre-existing education crisis. And I think we need to acknowledge that there are still enormous steps to go before every young person is in school, in having the kind of learning and teaching they would need. And there are social services that need to be involved, there are health services that need to be involved, and a wider whole of society approach to make sure that families are able to ensure that young people are learning and therefore able to fulfill all of the opportunities they may have. So in some countries, for example, countries with the longest school closures were those that already had lower learning outcomes before the pandemic. Within some of the countries, the learners that were more vulnerable to the impact of school closures than others, because they're the ones that rely on the protection and support services that school may provide to them. So if anything, the important role of the education system in protecting and supporting learners and their well-being has, I think, become even more evident. And I think we understand more about that role in the center of the kind of heart of our communities that schools are increasingly expected to play. So there's been a lot of efforts for the sector to step up to provide protection and support to adolescents as schools have reopened, to step up their health and nutrition services and their mental health services. At the same time, they're also really trying to catch up on lost learning to make sure that students pass exams or are able to move on to the next stage of their learning or their life. So really, there's a lot of responsibility that has ended up on the shoulders of teachers and of school principals. And I think we really need to recognize the enormous contributions they've made. So for us at UNESCO, we argue that the post-pandemic period is providing an opportunity to build back stronger and more resilient, more equitable and inclusive education systems. It's our opportunity to shift how we think about it, but we have to have a multisectoral approach for this. So when we look at the impact of the last 2 years on mental health or on social protection, for example, we can't expect education alone to respond to this. So we need the partnerships between education, between health, between protection system. And this is what we're talking about with this whole government approach. We need to unpack what does that mean in practice. Are there meetings happening? Is the coordination at the local level, at the regional level? Are there school nurses who are able to connect to social services, who can help identify if malnutrition or if other kinds of ill health or a lack of well-being is happening in a child's life? So there are lots of details that we do need to understand. But really, and this has already come out, we need to ensure that young people are being listened to. And this is really coming out loud and clear in the consultations. But for us, for example, during the pandemic, by engaging and listening to adolescents, we found out about the particular difficulties that different groups of adolescents were facing because of school closures. So for example, it was only through those consultations that we were able to learn that LGBT young people were facing much more complex difficulties and lack of protection. And so without engaging with adolescents, that's just an example. We're likely to miss the real issues that they're facing, or we won't be able to respond appropriately if we don't ask those questions and we don't make the effort to really understand what's going on in the lives of adolescents and how then the supportive environment and the safety nets and the ability to thrive, that we can all, through our different sectors, put what's needed in place to do that. Thanks.
Thank you so much, Joanna. You really highlighted the importance of addressing these challenges and inequalities through this intersectional lens and also using this multi-sectoral approach. Thank you also for highlighting how complicated and complex some of these challenges are and how important it is to have all partners and this whole of government approach as we're trying to address these issues and ensure that we're protecting adolescents' well-being. Elo, I want to move to you next. Building on what Joanna said, what do you think an event like the Global Forum can serve as an opportunity for this community to address some of the challenges mentioned in the report?
Thank you, Miret. One thing that has stood out to me throughout the summer report is the emphasis on multisectoral collaboration to successfully achieve our goals on adolescent health and well-being. Mona has just spoken to this in her address, and it's one of the 3 calls to action for adolescents, as you mentioned in your opening remarks. Frankly, to meet adolescents' multidimensional needs, we will have to come together and work together. The Global Forum for Adolescents, hosted by PMNCH, will be the largest global gathering to discuss adolescent health and well-being to date. This convening of partners is in itself a success for the adolescent well-being community. The forum will be the catalyst to kickstart the much-needed multi-stakeholder collaboration, investment, and global coordination to accelerate progress towards 2030 and begin to realize the recommendations within this report. Importantly, the forum plans to be a galvanizing moment, enabling young people to strengthen their engagement in civic space and demand political commitment for adolescent well-being. With a diverse list of attendants expected to participate, including youth-led organizations, ministers, donors, researchers, and civil society, The forum will showcase the evidence, research, and policy recommendations that conceptualizes the state of play for adolescents and youth today. And we know that many of our partners have been hard at work developing the evidence and carrying out the gap analyses and the social impact studies, as indicated within this report, to illustrate the needs of adolescents. We lean heavily on the technical guidance of Dr. Anshu's team at the WHO and the UN H6+ technical working groups. By focusing the attention of the world on the needs of our collective 1.2 billion adolescents, advocates, led by the youth, will be demanding for greater policy, financing, and service delivery commitments for adolescent well-being. It's notable that the forum will address the holistic needs of adolescents and young people across all aspects: health, education, employment, mental and physical health, and security. And nestled between the SDG Summit and the G20, it will be part of a wider moment of action for development stakeholders. If we get it right, then the forum will be just the start of long-term and sustained political will and action to meet the needs of adolescents by 2030. Last year, Save the Children released a briefing titled Investing in the Now and the Future, which declared 8 model commitments governments could take to accelerate progress for adolescent health and nutrition ahead of 2030. At the Global Forum, I'll be watching to see what steps world leaders will take to put pen to paper and make solid commitments for adolescents. Thank you, Murat.
Thank you. Thank you all very much for your insights. Now I'd like to ask each of you to share the top 1 to 3 recommendations from the report. You each will get just 1 minute, so try to be very quick and brief with your recommendations. So let me first give the floor to Shukti.
Thank you, Murat. And the top 1 to 3 recommendations that resonated the most with me were the engagement of adolescents. Their leadership should be strengthened so that they can hold the government accountable, and young people's participation should not be tokenized, and the suggestions and recommendations should be included in education, curricula, and services. And a rights-based approach for all young people to get equal and accessible services. All social groups in marginalized communities must be included. And there are several inequities when it comes to gender, language, and location, and they play an important role in the context of India and around the world. And the last one is strengthening of capacity building to improve adolescent well-being programs. There has to be more skill building programs for adolescents to learn and develop new skills, which will help them in leadership and promote their participation in policy making. Thank you, Mireille.
Thank you very much. Moving next to Dr. Zoya, you have 1 minute.
Okay, that's tough. Like I mentioned earlier, we need an integrated approach of multi-sectoral, whole of government. And I would say not just government, we have whole of society. We need to involve the parents also when we approach adolescent well-being. That is one. Number 2, I would say we do need regular mapping of the needs of the adolescents in a regular fashion, timely fashion. Number 3, I would say is, of course, engaging adolescent in whenever we're creating policies and programs so that we get their feedback. So broadly, just saying that we would never be able to address the challenges which are faced by adolescents if we don't take multi-sectoral and whole of society approach. We will never be able to know the expanse of, if we don't know the expanse of the challenges, we will not know what the feedback we get from the adolescents. So it's like all 3 components are equally important for us. Yeah, over to you.
Thank you very much. That was speedy round.
Yeah.
Next, Dr. Mona, the floor is yours.
I think so, the key message I'm listening from the consultation reports and the evidence coming out from PMNCH is that we need to just build some brave bridges across programs, across governments. We need to not only create projects that are cohesive, comprehensive, and impactful, but transformative for the future. Thank you.
Moving next to Joanna.
Thank you. It's very hard to pick one out. They're all important. I do think it's really critical to draw attention to adolescent wellbeing within a national plan. I think without that, you can't get funding and you can't mobilize attention to the issue amongst those different responsible actors at the national level. But I'd also like to focus quite specifically as my second key point, I think, on the importance of improving information and training for the professionals working with adolescents and young people to promote their well-being. And that for us is absolutely critical. So in the work that we're doing, we're investing in working with teachers to promote wellbeing interventions within schools. And there's plenty of evidence on what works. But whether it's comprehensive sexuality education or violence prevention programs in schools, but they rely on teachers who are invested in and feel confident to deliver it. And actually teachers really often talk about their lack of confidence in delivering that. They're seen now as like social support agents or health agents. And so as long as we can make the right investments and not in training and information and support systems, I think we have some structures there. And I think actually that teachers can become some of our best allies. And they're really critical people in the lives of adolescents and can really be very, very helpful partners and supporters in promoting their well-being.
Thank you very much. And last but not least, Elo, the floor is yours.
Thanks, Mairet. I agree with everything that panelists have shared, but coming from a child-centered and child rights organisation, the top recommendation for me would involve the operationalisation and endorsement of a meaningful adolescent and youth engagement consensus by all partners, stakeholders and governments. Back in 2020 at a Women in Global Health conference, I said the phrase, when we aren't consulted, we're not considered, with regards to women in global health. And really the same applies here. For decision makers to truly respond to the needs of adolescents and young people, we must engage with adolescents and young people and empower them to take up leadership and work closely with policymakers to ensure all actions taken reflect their true needs, concerns and hopes. Otherwise, I'm afraid we'll just keep missing the mark. Thank you, Mairet.
Thank you very much to all of you. I think the dominant recommendation based on what you've mentioned is meaningful adolescent and youth engagement and strengthening the capacity of stakeholders. So before we move to the closing remarks, I would like to move to my favorite part of this event, a rapid fire round. Here, I will ask each of our panelists to share what you think is most important for partners to do to promote adolescent well-being in programming. Here, instead of 1 minute, you actually only get 5 words. Please feel free to explain your response in 30 seconds. So 5 words, 30 seconds. Let's once again start with Shukti.
Thank you, Mairet. So the 5 words are better investment and better implementation of policies. For an adolescent to be well protected, educated, and employed, there needs to be better policies and stronger implementation for them. And there has to be more investment in formal youth avenues where young people can be a part of decision making and meaningful youth engagement. Thank you.
Thank you. Moving next to Dr. Zoya.
Okay, 5 words are very difficult. First is, I would say, support the government. Second is leverage technology. Third is amplify and hear adolescent voices. Fourth is building on advocacy, and fifth, finally, is research and evidence creation. And I would say all this together will only help the governments at least implement programs, because when we have evidence, we can implement and improve the programs. I'm done.
Brilliant. Thank you. Next, Dr. Mona.
I'd say it's mobilize and sustain policies for adolescents. And all the while, I'm sure evidence can always make us a bit more effective.
Yes.
Very succinct. Appreciate it. Next, Joanna.
5 words, adolescents, not a homogenous group. So what I mean is that we need to make a particular effort to reach the most vulnerable. So how does age, gender, ability, ethnicity, location, and other factors, how do they intersect and influence the adolescent experience? And we saw this in COVID-19. What works for one person doesn't work for everyone. So targeted interventions are needed. And I think that's the only way we're truly going to achieve stronger, more resilient, equitable, and inclusive systems that work for adolescents.
Absolutely. I think your summary word is intersectionality, and I love it. I really appreciate it. Last but not least, Elo, floor is yours.
Thanks, Mairet. Adolescents lead and sustainable investment. And I think for that is that we need adolescents to lead in the programming for the program to be effective. And we need so much more sustainable investment. I think less than 2% of global ODAs for adolescent health. We need to do better for adolescents so that programs actually do work. Thank you.
Thank you very much. Leadership, that's such a good one. Man, this is difficult. Now I have to do the same. I have to come up with my 5 words, but I think all of you have really said it perfectly. I think if I can share 5 words, I will use the acronym TEENS. So, technology, use social media, and meet adolescents where they are. E, the first initial recommendation, engage and empower. E, equity. As mentioned by our panelists, it's critical for us to use an intersectional lens and have these targeted interventions in addressing adolescent well-being. N, no one left behind. Critical to achieving UHC and critical to adolescent well-being. And finally, skills. I think we mentioned how important strengthening the capacities of stakeholders are. And here I want to really emphasize skills, not just for young people, but skills for whoever is providing care, whether it's education sector, health sector, multisectoral approach. Capacity building is key. So teens, I would say that's my summary 5 words. Now, in closing, I would like to invite Helga Fawcett, Executive Director of PMNCH, for the closing remarks. Thank you again to our esteemed panelists, and the floor is yours, Helga.
Thank you so much, Mirette, and thank you to all the panelists, and greetings to everyone. It is a pleasure to be with you from the official side event to the ECOSOC Youth Forum, promoting adolescent well-being to secure our future. Thank you very much for joining this event and for your commitment to adolescent, a priority population that has been left behind in the SDGs. So this ECOSOC Youth Forum is a critical opportunity to influence the high-level political forum to ensure adolescent and youth issues are a priority at the upcoming SDG Summit in 2023. At PMNCH, it is essential for us to work in partnership with young people to collectively contribute towards achieving the SDGs. We have a vibrant adolescent and youth constituency with a platform of over 100 youth networks in leadership positions in line with the principles of the Global Consensus Statement on Meaningful Adolescent and Youth Engagement. Today, we have launched the report of the multi-stakeholder consultation on programming to promote adolescent well-being, which makes it very clear that efforts to support adolescent well-being have tended to be piecemeal, with different sectors focusing exclusively on their own areas of expertise and sometimes losing sight of the overall objective of promoting adolescents' right and well-being more powerfully across all sectors. We are here to change this. We know that the power of young people is probably the most untapped yet critical resource that we have at our disposal today. Thousands of young people are driving transformative change, and many more are poised to do so, but often lack the opportunity and means. It is essential that we as a community, including young people, come together and demand for action towards issues that affect adolescents and youth the most. We must all do more to support the 3 asks of the call to action for adolescents, as well as the global, national, and subnational actions outlined in the multi-stakeholder consultation report. In response, PMNCH, WHO, and the UN Health 6+ agencies and the Adolescent Wellbeing Workstream have committed to implementing the 9 global level actions presented in the keynote presentation. In addition, PMNCH will host a global forum for adolescents in 2023 alongside the UNSG summit with the aim to realize the call to action for adolescents. This will help us achieve our collective vision for concrete policies, integrated programs, and sustainable investments for adolescent well-being. Leading up to the forum, we have developed an advocacy roadmap highlighting key opportunities for us to push this agenda forward at 3 different levels, including UN meetings and events, PMNCH-led events, as well as international days, which you can then see on the slide. We greatly appreciate your participation and encourage young people to join the Adolescent 2030 campaign to make your voice heard leading up to the Global Forum for Adolescents in October 2023. PMNCH has developed a set of resources for partners to use for advancing this agenda, which are found here in the channel description. Together, we will work in equal partnership to deliver a more equitable and inclusive world for this and future generations. Thank you, and hope to see you soon.
Thank you very much for your closing remarks. Wow, this was an invigorating discussion, and honestly, it left me very motivated. I would like to thank all the panelists for their insights, as well as the co-organizers for this event. Thank you, PMNCH, WHO, UN Women, UN AIDS, UNESCO, UNFPA, UNICEF, the World Food Programme, and other UN major groups, and the UN Major Group for Children and Youth. Today was truly motivating, and I hope it inspired all of you to take action and support the adolescence agenda. To those of you who want to be part of this journey of change, remember, your voice, your input, your action is vital. Every small or big step is a step towards progress, a step towards leaving no one behind. And this is what will help all of us realize this big goal. Thank you again, and have a good day.